Good morning, everyone. A passion for dermatology at the age of 12, also continuing her education of MBBS and MD at KMC Hospital, Mangalore, moved on to do her preceptorship at Skin Laser and Surgery Institute in New York, followed by a 3 month fellowship program, dermatology, dermoscopy in the study of moles at Cardiff University, UK. A special area of interest being aesthetic dermatology, and has also attended various workshops in India and abroad. Recently, this lady has undergone a training ultra pulse fractional CO2 resurfacing for burn scars, keloids, and acne scars at Milan, Italy. With immense pleasure and privilege and honor, I introduce to you the beautiful and gorgeous Dr. Vindya Pai.
I welcome you all for this gathering on acne and acne scars. So I would want to first explain to you all the basics of how an acne or an acne scar is produced. So I have with me an schematic representation of a hair follicle. If you can see, this is a hair follicle here, and this is the skin, as you all can see. And the main gland that is responsible for the production of acne or a pimple is this very tiny gland. It is actually the shape of a cauliflower, but it is a very tiny gland which is present in all of us, and that is the main gland that is responsible for the production of acne. So why then don't all of us get acne? It's only a few of them that get acne. But all of us have this gland within us. The main reason for this is a host, so many factors up there. In that, I would like to highlight on each of the causes of acne. One of the important factors for the production of acne is our genes. That is, if we have a family history of acne, then invariably we would be having oily skin, and that small gland will produce a lot of sebum or oil, and that oil content actually blocks that hair follicle. That entire length of the hair follicle is blocked by sebum or oil, and also this hair follicle has a lot of cells within it, and all that is going to accumulate with the oil, and that will help in the production of acne bacterium. So basically the bacteria, the sebum or the oil, and plus the lining cells of the hair follicle, all this accumulates and it forms what we can see on the skin as a pimple. And now there are different grades of acne as well, which I will be highlighting here. So as you can see here, this is the small gland here that is responsible for production of acne. So once this entire length of hair follicle is blocked because of oil, because of the cells lining it, and plus the acne bacterium that grows in a moist environment. So then you can see here that the whole hair follicle is blocked, and it appears as a production of acne on the skin surface. And again, I said genes are a very important role to play. So family history is very important, and plus there are a range of other factors. Like one of the factors is diet. I'm sure you must have heard your grandmothers or anybody else, educating you about you should not eat fried food, you should not eat too much sweets, all this. Of course, they have a huge role. I would again be highlighting that dairy products, especially milk, play a huge role in the production of acne, because they have something called growth factors within them. They also have hormones within them that stimulates our existing hormones, and plus it results in the formation of acne, and plus they have an iodine content in milk, which in the recent research studies have shown to produce acne. So basically dairy products very important to avoid, to help to prevent acne, number one. Number two is also sweets, especially in sugar, also can just increase your glycemic index and increase in the growth factors again, and these growth factors also trigger this small gland. So once that gland is triggered, then automatically a lot of hormones will be produced. That is, the main hormone responsible is androgen. that is the male hormone, which is present in males in a lot higher content than females, but females definitely do have it. And if at all this gland is triggered, then androgen hormone just rises, and because of that also we can get formation of acne. So this is, as we all know, there are something called whiteheads, which all of us have seen. They appear on the forehead and some on the cheeks and all that. All those are the initial stages of acne. So as we progress, blackheads and whiteheads, you can call, they are the grade 1 stage. So once it becomes grade 2, then we get something called infected acne. You might have seen so many of them having red colored infected kind of acne on the face. And once this grade 2 stage progresses, it becomes grade 3 and grade 4, which means the same infected acne but in bigger sizes. It becomes nodules, it becomes really huge in size, and then it results in scar formation like this. So basically, why is it important to treat all this? Why can't? Because it's not going to affect your health in any way, which you might realize that it's not going to affect my heart or my important organs. But why is it important to treat skin condition? Because I believe that the first thing you see in the morning when you wake up is your skin, is yourself basically. So if your skin is not healthy enough, or if it's not clear enough, automatically whatever you might say, no, I'm not so interested in aesthetics or looking good, looking beautiful and things like that. But whatever you say, it affects you. It affects your self-esteem, and once you undergo that lowered self-esteem, you don't want to step out, you don't want to have any social relations. You ultimately go into a mild form of depression, and once your psychological aspect is affected, it affects each and every area of your health. I said the hair, each and every hair follicle has sebaceous gland, and on the scalp it is even more. They have a lot of this activity. So it triggers this sebaceous gland and they develop dandruff. So yes, it is definitely related. This bacteria and this yeast, it grows in a moist environment. So wherever it is moist and oily, it grows. So there is a relation between dandruff and acne. It is the same environment that helps the growth of these organisms, and one of the main ways of preventing is by educating them about the proper usage of oils. I am not entirely asking them to stop the usage of oils, but at least minimize the duration of usage and apply it with the right quantity. And also because I have seen so many of them, they apply these oils and then it starts dripping on the forehead, and they develop all these acneiform eruptions on the forehead. And especially if they are using two-wheelers and all that, they have to wear a helmet. So because of the occlusion of the helmet also, and plus these oils and plus all the sweat, again it's a moist environment, it grows and they develop acneiform eruptions, dandruff, all that. And once it triggers the glands, then it's a step-by-step process. Grade 1 becomes grade 2 in no time. Grade 2 becomes grade 3, and so it just goes on. So all these preventive steps are important.
Also ma'am, people who have a complaint with acne and pimples, I believe we all have a habit of popping the pimples out. Whether it's a good habit or a bad habit.
It's a very bad habit. We actually advise against it, because what happens is they are the main reason for production of scars. Because it becomes a habit, it becomes an addiction, and it becomes a stress relief agent for so many of them, especially during exam times and things like that. They just go on picking their skin, and that nails are the result of production of all these scars, because they just manipulate it in such a way that they ultimately remove the acne, they produce the raw skin there, and when the raw skin is getting healed, it forms a very ugly scar there. So I see a lot of these youngsters, adolescent, teens, especially immediately after the exams they come and they say that we have had all this, and when I ask them the history of whether did you remove the acne, they say yes, we did. But unknowingly, when they are studying and all that, they are so immersed in their books that they just do all this. But it's very important to educate them against it, because once a scar is produced, I am not saying that if it is in the early stages, yes, it can be treated 100%. But if it is there and if it is deep, then we can only improve it up to 85 to 90%. So
So we all should not poke our scars. That's one very good take-home message today. No poking of scars and pimples. Ma'am, one more important question is people believe that because they do not have a good facial hygiene, they keep on washing their face repeatedly so that we can prevent pimples and acne. Is it a good practice? Keep on repeatedly washing your face.
As I said, excessive dry skin is also bad, excessive oily skin. So yes, if you have genetically an oily skin, you can use good face washes to bring down the oil content. But again, excessive usage of any one product is harmful. So try to strike a balance. At least twice or thrice a day if you can wash your face, it's good enough. But a few of them have repeated, they're obsessed with it. They use scrubs and all these abrasive soaps and things like that, and they create actually more harm than good.
Scrubs, I believe it increases the breakout because without
Yeah,
consultation, they use it a home remedy. I think it can lead to more scars.
Scrubs probably once in a week is good for exfoliating and all that, but repeated use twice a day and things like that, it's actually creating more harm. And also a few of them are allergic to the fragrances present in it or some ingredients present in the creams which are available over the counter. So, but they will be unaware of that. So actually, as and when they are putting the creams which might actually have good ingredients in them, but if they are allergic to one of these ingredients in them, they can actually produce an irritant dermatitis, their allergic dermatitis and things like that, and they can actually have a problem which is looking like an acne. We call it acne form eruptions. So we have to understand why it is getting produced and then advise them against it and then go ahead.
So before we move on to the treatment options, would anyone of you want to ask any doubts or any questions to Dr. Vindya Pai? ಯಾರಿಗಾದ್ರೂ ಏನಾದರೂ ಕ್ವೆಶನ್ ಕೇಳಿ ಟ್ರೀಟ್ಮೆಂಟ್ ಆಪ್ಷನ್ಸ್ಗೆ ಹೋಗುವ ಮುಂಚೆ ನಿಮಗೆ ಕ್ವೆಶನ್ಸ್ ಇದೆ ದಯವಿಟ್ಟು ಕೇಳಬೇಕಾಗಿ ಕೇಳ್ಕೊಳ್ತೇನೆ.
If untreated, sometimes it subsides on its own, but I would say that the damage would already be produced before it stops. Because I hear so many of them saying, they come to me at the age of probably 28, 30 after they have a kid and all that, and they say when we were adolescents, we had very bad acne, but we didn't do anything about it, and it stopped on its own. But I have these scars now. So the skin is like a war zone between the bacteria and between our immunity. So the body also tries to fight against the bacteria. Bacteria is trying to enter our skin. So ultimately the skin takes a toll. So it will stop because, as I said, it's all the hormonal ups and downs which is producing this. So once the hormones subside or once our body gets used to it, automatically it will stop at the age of 18 to 20, but the damage would have already been created.
As you said, pinching of the pimples is bad. For example, when we shave, the pimple erupts because of the blade. Now, will that cause a scar on the face?
It can cause a scar, but again, when you're doing it with a shaving thing, it's an even removal. In the sense, it's an even damage you're creating. But when you're doing it with your nails and stuff, it's not even. It's an uneven damage. So whenever you're doing it with your nails and things like that, it forms a scar. But when you're doing it, I'm not saying that you have to remove it with a blade, but accidentally when it is removed by a blade, it forms a scar, but it forms a nice looking scar. So it is not so obvious.
Okay, I think
I'll just show you a few more pictures before we move on. Yeah, so this lady, her main problem when she actually came to me, she had so many pimples on her face. I don't have the previous picture. She had a lot of pimples on her jawline, or on her chin, on her neck here, and everything. So ultimately, I didn't want to start lasers for her directly because her main problem was a hormonal imbalance what she had. So I treated her hormonally first. 6 months I gave her something called isotretinoin, which is a vitamin A capsule, and with that she cleared a lot. And after that, whatever scars were remaining, she had a lot of these scars called as ice pick scars. Over here you can see these dots like a like
So, can we know the various treatment options that we have for especially acne and pimples?
Yeah, for in case of individuals having infected acne or these red kind of pimples, normally we undergo I do an laser called IPL, intense pulse light. It works very well. It decreases the redness, it decreases the infected acne, and but only thing is they will have to undergo those treatments every 10 days for about 3 to 4 times, and it definitely works. We don't have to use so many creams and all that. So I do an IPL treatment for patients having active acne, and if they have scars, then depending on the depth of the scar, if it is a superficial scar, I use one type of laser which is known as a Resurfax the laser, which I used on that student. So there is no side effects, there is no downtime, they can go immediately to their work. It doesn't produce any only for maybe half a day it produces slight swelling, that's it. But if at all the patient has too many scars, deep scars, and lot of, only then we'll have to undergo that fractional CO2 laser, and that fractional CO2 laser is a deeper form of laser. At least 3 days of indoors they have to be there, and they should avoid sunlight, all those things, but it definitely works. Single treatment also produces a satisfactory improvement. Of course, they would require 2 or 3 treatments, but if they want to do just one treatment, that would also be enough. It produces a significant difference.
Now, having said that and the treatment options, I'm sure the next question in your mind will be, is the treatment expensive? What about the cost?
Yeah, so basically all these treatments are in the range of starting from 2000 rupees, it goes on up to 8,000. So I have tailored the treatments in such a way, they can develop good results, but it should be affordable to everybody.
Any other general questions would you like to ask? Any of you?
Hair color, yeah, a few of them they have allergy for hair dyes, and for them we have separate hair dyes, separate shampoos which are available, which do not have all these harmful ingredients in them. So, but otherwise, if a person is normal and doesn't have any allergic or irritant reaction to a hair dye, then they can use any hair color. There is no problem. And another one concern in hair dye which I have seen is over a long period of time, the ones who have used hair dye, they have hyperpigmentation, they have blackening of the skin. So they slowly develop darkness in their face. So that is one of the problems of hair dye usage. So basically, they may or may not be irritant to the hair dye. If they are irritant to the hair dye, it is immediate. They develop immediate boils and all forms of a reaction. They have to stop usage of hair dye immediately. They have to first get themselves treated from that existing irritation, and after that they have to switch to hair dyes which do not have all these harmful ingredients. And but if a person doesn't have any allergy or irritation to hair dye, they can use it, no problem. But a few of them I have seen, they have this darkening of their skin, which is also a form of an allergy. So they have to keep a close watch on themselves, whether they are allergic, whether they are irritant. Irritant and allergy is two different things. Irritation means as soon as they use the hair dye, they develop an irritation. They have itching, they have boils, they have to stop it immediately. Allergy is slow process. As soon as they put, they don't feel anything, they feel fine. But over the course of time, they notice that their skin is getting dark, their scalp is getting itchy. So we have to identify whether we are irritant, whether we are allergic, or whether we are fine with it. So that is the thing.
Ma'am, this is a general question, but I believe even I was a person who have suffered a lot of acne issues when I was in my teenage. So maybe the common question would be like, when a dermatologist prescribes a cream, is it that we have to use that cream only in that area where we have a problem, or is it the full area which we need to cover?
No, there are again different creams available now. There are a few creams which have to be applied only on the acne spots to bring down the to bring down the infection present in the acne. But then there are few other creams which are known as vitamin creams for acne. They can be applied all over the face. So to prevent acne in other places also. Because once you have an acneiform eruption on one particular area, you would be triggering the other skin also. to produce an acne. So there are creams specifically to apply on that spot. There are creams to apply everywhere also. So depending on what kind of skin problem you have, or depending on what kind of acne you have, we can tell you which creams to use.
And second question, like, is makeup a completely no-no for a person suffering with acne?
No, I feel every lady or every woman for that matter wants to look beautiful, and we all enjoy wearing makeup. So I normally advise them to use makeup. So I tell them to use one particular cream in the beginning as a protection for your skin, and on top of that I recommend to them, depending on their skin tone, skin type, which type of makeup is applicable for them. So whether it is a cream based, whether it's a powder based, whether it's a lotion based, whether it's a spray based, which type of makeup, and also depending on their lifestyle, their occupation. Like somebody is an actor or in front of the camera, I cannot ask her to just put some low grade makeup, they have to put heavy makeup. So even in that there are various brands which I prefer usually, and I tell them, okay, you use this is good for your skin, for your skin type, this is best. So I normally prescribe makeup. I enjoy wearing makeup, and I'm sure others also do.
Right.
So I normally prescribe, and it's very safe. There's no problem.
A couple of things we have to keep in mind. Is sharing the makeup and brushes, is it a good habit, ma'am?
No, sharing makeup is fine if it is, but sharing brushes, I totally avoid them. Even when we are using our brushes also, it is mandatory to clean the brushes every week or twice a week if you can, with mild soap and water, because ultimately all these bacteria grow in the makeup brushes, and that itself can actually cause all these small acneiform eruptions to erupt. So cleaning, hygiene is important in any form, whether for your skin or for your cosmetics or for the brushes, it's very important.
So yes, if a person is having acne and his brush is used by, usually this happens during a dance makeup and all. Yeah. So it spreads.
Acne doesn't spread from one person to another, but the brush has different types of bacteria that it grows. So the other person, if at all they are also prone to have an acneiform skin, that brush bacteria can irritate their skin and form acne. But acne is not an infectious disease, it doesn't spread from one person to another. But bacteria can grow in all these fomites, and they can produce a little bit of eruption. Yeah.
What about using lipsticks?
Yeah, lipsticks is also very safe. I always recommend them to use a lip balm first. There are certain skincare regimen for the lips which I normally advise. I always tell them to exfoliate their lips every early mornings. Night time when you're sleeping, you can put a lip balm, sleep off. Early morning with a soft cloth, you can just rub your lips and bring out the thicker skin that has deposited on the lips. So it's known as exfoliating. And after that, you can again put a light lip balm and then whatever lipstick. Again, products from a good reputed brand is always best. But moisturization of the lips is mandatory. If you try to rub your lipstick on dry lips, number one, it looks bad. Number two, it's not good for your lips. And also this repeated lip licking, a few of them have this habit. Again, it's one of the stress relievers, I think. A few of them have that repeated lip licking, they try to bite their lips. All this can cause blackening of the lips, darkening of the lips. Of course, there are treatments to remove that also, but again, as I said, prevention is better than cure. So, moisturization of your skin and lips is very important. Moisturizers are available for different types of skin. Oily skin person also should use a moisturizer, but it is an oil-free moisturizer. In a sense, it doesn't produce any oiliness on your skin, but it gives the right amount of nutrition for your skin. So, moisturization is mandatory for all types of skin. Sunscreens are mandatory for all types of skin. If you want to take care of your skin, that is. A few of them, they say we have never done all this and we are fine. That's a different thing altogether. But if you want healthy skin, if you want good skin, then all these certain tips are important.
Take home messages for today, ladies, men. So I think we all need to emphasize on one thing: your skin is a mirror of our image, of our soul. Whatever goes inside, it is reflected on our skin. So even the smallest changes in our skin can detect something which is going on in our body. So it's very important for us to take care of our skin, and also especially the ladies, as we discussed acne related problems today. I think most of the teenagers are facing these issues today. So taking care of all these advices, whatever we have discussed today, I think you all can go and spread the message outside so that it could be useful for everybody. So let us all feel good, look beautiful, and be beautiful. Thank you so much
Thank
for
you one
your
and all for
contribution.
coming, for gracing the occasion. Thank you for supporting.
Thank you so much.